So we'll start at the top of the GI tract. Between the stomach and the small intestine, there's a pyloric sphincter. When this sphincter gets really thick, it's called hypertrophic pyloric stenosis. So I want you to think thickened sphincter. So no food can pass, so pressure and food builds in within the stomach. It has nowhere to go except up and out the mouth, and that causes projectile vomiting. So not just regular vomit, but vomit that goes across the room and literally hits the wall. Then this leads to our major complication, which is dehydration. So when there's a lot of vomiting, we lose a lot of fluid. And we're worried about this, especially in kids, because they have a greater body surface area to mass ratio, so they lose fluid fast. So what do these kids look like? Well, we'll have non-bilious projectile vomiting followed by hunger. This is because food is not getting into that small intestine where bile is added, so it's non-bilious, and that food's not being absorbed in the small intestine, so they're hungry all the time. Then we have an olive-shaped right upper quadrant mass because of that thickened sphincter creates an abdominal mass. Signs of dehydration are common because of all that vomiting, and this mostly affects infants, so we'll see sunken fontanelles and absence of tears when crying. So what do we do for these kids? We need to manage fluids and electrolytes. Remember, because they're vomiting all the time, we need to make them NPO. We don't want to add anything to that stomach, and we need to decompress that stomach by putting in an NG tube. So remember, we need to monitor for dehydration. NCLEX tip, if any child or client is vomiting, we need to worry about dehydration, and we need to prepare to give fluids. And for these kids who are NPO, we need to give IV fluids and electrolytes as needed. So this is treated with pyloromyotomy surgery, which opens up that thickened sphincter. Then we need to monitor them post-operatively. Once bowel sounds return, remember that indicates return of bowel function, we need to give small, frequent feedings. We need to start with clear liquids and then we'll progress to breast milk or formula as tolerated. Then vomiting is expected in the first 48 hours, but anything that persists beyond that should be reported.